Welcome to the Senior Network. I'm Christyn Gialanella, joined with my colleague, Dr. Kamal Patel. Thanks so much for being here today.
Thank you, Christyn, and the Senior Network for having me.
Awesome. Well, what I thought we could talk about today was concierge medicine. This is an interesting topic for you since you recently transitioned from a traditional primary care practice to concierge medicine. For our audience, can you share what is concierge medicine?
Sure, thank you. Concierge medicine, I transitioned. I was in traditional practice for about 15 or so years, and end of last year, decided to kind of slow things down a little bit. What I realized in traditional practice was it was just the pace of seeing volume.
Absolutely.
Was just that, and so it just left too little time to really kind of go in depth into patient needs and concerns. And so concierge medicine, basically, really in a nutshell, it's trying to take away the element of time being your enemy. It's more now an asset. Time is not an issue for the most part. We're there at the access, whether it's during office hours, it's after hours, they've got my direct contact number. Our staff generally knows everybody by name and face and vice versa. So you're dealing with an office of 2 to 3 people rather than an office of 30 people, and then things get dropped and so on and so forth. But really it's just trying to take the needs and issues that patients have and guide them through the entire course of whatever it is that is necessary, and how do we help facilitate those issues so patients remain healthy, and when they have an issue or time of need, that obviously those things are addressed as efficiently as possible.
Wonderful. So it sounds like it's a much more personalized approach to medicine. Is that fair to say? Absolutely.
I mean, it's no longer a conveyor belt assembly line process where everything has to be done almost the same way. Simply because time is just such a challenging thing to get around. And with concierge, everybody is an individual, treated as an individual, and if something works well for one person, it may be completely different and more customized for the next individual. It just really depends on kind of what's best going to be for that one individual.
Okay, excellent.
Case basis.
The other thing that jumps out to me is just access in general. Many of us know that trying to reach our primary care physician can be really challenging at this point due to just the sheer volume of calls they receive each day. So patient access obviously is what appears to be a huge perk of a concierge practice.
Absolutely. I mean, what we would like to say is if they need to be seen, they'll be seen within same day, next day.
Wonderful.
We'll always make it work. I mean, they've got my number after hours, so I mean, we're always going to be available. So if it's not a formal visit, it could be a virtual, it could be a phone call.
Excellent.
I mean, we'll make sure to guide them through a process if it's an acute issue, but also help hopefully long-term keep them healthy as well.
Wonderful, wonderful. What would you say, the difference is in your new concierge practice? How does it allow you to better care for your patients? I know we touched on some of it, but is there one thing that really stands out to you?
Yeah, besides time, I mean, we're going further into the processes where it's not just about, here's your basic blood work and here's a quick checkup. It's going more into the dynamics of your stressors. How are you exercising? How's your diet doing? How's your sleep? All the core elements of hopefully trying to keep you healthy. But we're so busy as individuals with challenges going on, and we take them on our shoulders, and sometimes we internalize them, and that evolves and affects how our health is, and we don't always realize how impactful that could be. And it's my job to kind of help hopefully dig into some of that and kind of see where we can make some corrections, some things that are achievable, and hopefully kind of stop them in their tracks before they become large issues.
Wonderful. Well, thank you so much for being here today. Always a pleasure.
Thank you, Christyn.
Thanks.